So thanks, James, and I am very happy to be here today to be able to participate in this meeting. I'm going to talk to you today about the WHO Global Vector Control Response, which really is something that came where the real initiative for pushing this out came from some of the outcomes and lessons from Zika. So I'm going to focus on the building of the response and where the energy for that came from. So to follow on from what from a slide that James presented, in May 2016, sort of midway during the Zika epidemic, Margaret Chan, the former Director General of the WHO, made an opening address to the World Health Assembly where she really credited the spread of Zika, the resurgence of dengue, and the emerging threat of chikungunya to massive policy failures in vector control. And this really led the members of the World Health Assembly at the time to call for the development of a global integrated response that would target vector-borne diseases across the board. This slide gives an overview of the global burden of vector-borne diseases. As you can see, there are a number of diseases that affect many people in the world. These vector-borne diseases can be obviously parasitic diseases such as malaria, LF, onco, and can also be viral diseases. Zika I've highlighted here, but there's also dengue, which affects there are almost 100 million annual cases reported each year. Yellow fever, which is there are ongoing outbreaks, Japanese encephalitis. And the global distribution of the major vector-borne diseases, there are more than 80% of the world's population today that are at risk for at least one vector-borne disease. Vector-borne diseases account for almost 17% of the total global burden of infectious diseases. This is an amazing amount of the world's population that are at risk for vector-borne diseases, and more than half of the world's population is at risk for two or more. This map shows the combined global distribution of malaria, dengue, lymphatic filariasis, leishmaniasis, JE, yellow fever, and Chagas disease. And you can see that these diseases primarily impact the tropical and subtropical regions of the world, and they also disproportionately impact the very poor. So historically, there have been very successful vector control programs. These have largely been vertically structured and focused on disease prevention. But these were very difficult to do properly and very difficult to sustain. And in fact, we've seen the bounce back of Aedes aegypti in these areas. In more recent years, we've seen great benefits from vector control in, for example, malaria, although onchocerciasis and lymphatic filariasis have also shown major benefits from vector control. There are currently an estimated 1.2 billion fewer malaria cases globally, and many of these improvements are due to vector control, primarily vector control measures like long-lasting insecticidal nets and indoor residual spraying. 70% of the reductions in sub-Saharan Africa are attributable to these interventions, and of this, 69% is attributable to insecticide-treated nets and about 10% to indoor residual spraying. So these are gains that are really obvious that we can capitalize and use in terms of advocacy for vector control moving forward. So there are a lot of challenges for targeting vector-borne diseases, and I'm just going to touch on a few of these. So the systemic challenges are a huge concern to us, and these really are the public health capacity, the entomological capacity, and including human entomologists, and infrastructural capacity for research. That is really an area that needs a great deal of support. Structural, as I mentioned, the successful vector control programs in the past have been strongly centralized programs, and this is really lacking in a lot of countries. Informational, there's a need, and this was touched on in the last session, for links between entomological data, epidemiological data, and the intervention data. So what is the evidence for where we use these interventions, how we can target them? And that's something that's a knowledge gap that really needs support. Obviously, there are environmental challenges. We talk about the impacts of global warming on the spread of vector populations, distribution of vector-borne diseases, the impact of movement of humans and goods in terms of spreading diseases into new areas, in terms of spreading vectors into new areas as well. And there are political and financial challenges and ethical challenges to overcome. At the same time, this is really a time of opportunity in terms of being able to implement global vector control responses, in the sense that there is currently a lot of recognition and a lot of energy going into targeting vector-borne diseases. There are regional and global vector-borne disease control strategies. Many countries have pressed the importance of targeting vector-borne diseases. And there is ongoing data generation of successes against many vector-borne diseases, including malaria, onco, and lymphatic filariasis. So there's the opportunity to capitalize on these successes and the programs in terms of vector control in the future. I also wanted to point out one more thing on this list, which is innovation. That for many years there's been a dearth of new insecticides and new tools for vector control. And now there are so many new tools that are coming forward and that are being developed by different individuals. And these can really help target a lot of the problems for vector control that there are. So these challenges and opportunities, both together, have led to the development of a global vector control response. This is a response that was led by the Global Malaria Program, the WHO Department for Control of Neglected Tropical Diseases, and TDR, the Special Program for Research and Training in Tropical Diseases. So it was a cross-departmental effort to develop this response. And just to show you what went into developing this response, this initiative began in June 2016, and it was approved by the World Health Assembly in May 2017. So in under a year from the first set of meetings, a steering committee was formed, several meetings were held, I think 2 in-person meetings and 2 teleconferences. It went through a number of drafts, broad stakeholder consultation, online consultations, and then the little yellow star, I'm sorry, I don't have a pointer. So the yellow star at the bottom indicates when the executive board reviewed this, and then in May 2017, just several months ago, this went to the World Health Assembly. Many people were involved in this discussion. As I mentioned, the steering committee, it had broad stakeholder consultation, so this is just to give you an idea of all the different people who were involved in developing this. And the response, if anybody wishes to download more information on it, is posted on the WHO website. It was translated into 6 languages. And so to tell you a little bit about the contents of this response, the rationale for this was really as follows: that vector-borne diseases account for almost 20% of the estimated global burden of communicable diseases. They disproportionately affect poor populations. There's significant economic impact, and they're strongly influenced by social, demographic, and environmental factors. the idea is that vector control, studies have shown that if it is implemented well, it can really prevent major vector-borne diseases. It has contributed to major reductions in vector-borne diseases, and it really needs to be strengthened by realigning programs to optimize the delivery of interventions that are really locally tailored. This is an overview of the whole global vector control response. At the top, we have reduce the burden and threat of vector-borne diseases that affect humans. This is the overall goal. The mechanism of action for this is through effectively and locally adapted sustainable vector control. And there are 4 pillars of action that this response focuses around. The first is strengthening inter- and intra-sectoral action and collaboration. The second is engaging and mobilizing communities. The third is enhancing vector surveillance and monitoring of evaluations of intervention. And the fourth is scaling and integrating new tools and approaches. All of this is built on a foundation that desperately needs enhancing, which is that of vector control capacity and capability, and also an increase in both basic and applied research and innovation to target many of the gaps that are there in implementing vector control. Enabling factors for this include country leadership, advocacy and resource mobilization, and regulatory policy and normative support. So in terms of the vision and the actual goals for this, as I mentioned, the vision is a world free of human suffering. And the goals are ambitious. Reduce mortality due to vector-borne diseases globally by 75% in 2030. Reduce case incidence due to vector-borne diseases globally by 60% by 2030, and prevent all epidemics of vector-borne diseases in all countries of the world. This was taken up by the World Health Assembly and was unanimously supported by member countries. There were 36 country interventions, countries who spoke positively about this response on the record in the World Health Assembly, with 3 regional interventions, and these were individual countries who represented a broad range of countries within their regions. And this was adopted without any amendments in the World Health Assembly. And what we really hope that this will do is to galvanize country leadership for vector-borne disease prevention and control, to ensure that policies and activities are really integrated across sectors rather than being confined to the health sector, and that the evidence base for use of those policies and activities is very much developed. Also, there's a great need to harmonize and strengthen the actions within countries and between countries, to have integrative community-based approaches. There's a recognition that we really need new tools to target many of the problems, many of the challenges that there are in vector control currently. And the aim is to ensure that all countries can achieve the success regardless of their current disease burden, regardless of their current risk, and regardless of their capacities and resources. So thank you, and again, you can find more information on the global response on the WHO website.